Thanks for tuning in. I'm Scott Walter.
And I'm Michael Watson.
In this episode, we take a look at how lobbyists, lawyers, and advocacy groups have influenced the nation's devastating opioid addiction crisis. This is the InfluenceWatch podcast. On Tuesday, New York City Mayor Bill de Blasio announced that his city was suing 8 manufacturers and distributors of prescription painkillers for costs New York has incurred for dealing with the country's opioid addiction crisis. New York City isn't the first government to sue drug makers for allegedly causing the crisis. The state of Ohio and city of Everett, Washington have also done so. Laying aside the left-wing politician's publicity stunt for the moment, it's impossible to see drug overdoses, which killed an estimated 64,000 Americans in 2016, as anything but a major social problem. The Trump administration has officially declared opioid addiction a public health crisis, which opened up some limited federal funds for relief. In December of last year, Fairfax County, Virginia, a suburb of the nation's capital that is the second richest county in the United States, saw 8 overdose deaths in 9 days. Despite the efforts being made, the crisis continues. It involves numerous interrelated public policy issues, and behind it are influencers, politicians, and advocates who, although they may sometimes have had the best of intentions, have nonetheless contributed to the problem and are now stuck trying to fix it. Mike, let's begin with Mayor de Blasio's lawsuit in New York City.
So whatever you think about Bill de Blasio, obviously he's a very far-left guy. His administration is propped up by a bunch of the far-left hangers-on groups.
And unions.
And starting with and many working for the labor unions. On this issue, this is not really a crazy thing. The lawsuit in Ohio was moved by State Attorney General Mike DeWine, who's a Republican. Now, some reasonable question among legal observers whether there's a legal there, whether there's actually a legal cause of action against the manufacturers, distributors of opioid painkillers. In the mid-2000s, they actually did reach a settlement with Purdue Pharmaceuticals because they had done some sleazy marketing stuff, but that was dealt with then. So there's some question as to whether there's legal merit here, but Mayor de Blasio looking for a way to do something, the opioid crisis on Staten Island in particular, is almost apocalyptically bad, hardly crazy.
Well, that said, the mayor probably didn't come up with the lawsuit idea on his own. There's a history of sorts, isn't there, of this kind of governmental lawsuit against a particular sector of business. One of the obvious ones that come to my mind is the tobacco litigation so prominent in the 90s.
Tobacco and asbestos. The problem with the way that those lawsuits were set up, especially the tobacco lawsuit, the tobacco master settlement, is that a lot of the money ended up going to trial lawyers, some of whom were real sleazeballs. Dickie Scruggs was a famous lawyer who was one of the partners in the law firm that worked with the state of Mississippi on the tobacco litigation. He would later go to prison for bribing a judge.
Yes, and we should point out that he was the brother-in-law of then Senate Majority Leader Trent Lott, which no doubt increased his capacity to influence such things.
Increased his political clout and may have helped him think that he was going to get away with things like bribing a judge.
Yes, and I think we should also, given our own history and what InfluenceWatch.org covers thoroughly, observe that two groups that a lot of Americans forget are massive players in politics are the labor unions, which you mentioned earlier, who pretty much are responsible for Bill de Blasio having his current job, for that matter, having the nomination. But in the case of Dickie Scruggs, brings to mind the other big group often forgotten, and that's the tort bar, or in crude layman's terms, the ambulance chasers. And lawsuits like this, where you have, when governments try to sue a big chunk of business to have the golden egg laid by that goose, they typically involve with themselves outside lawyers, not just their own attorneys general, but outside lawyers like Dickey Scruggs' firm. And there's a division of spoils, and those tort lawyers then are often found to be among the most prominent and generous of contributors to the politicians involved.
Absolutely. And there's also if I can add, specific to the tobacco settlement, there's another kind of sideline issue, and that's that if one of these litigation proceedings looks like it's going to go bad for the industry settles, and then the industry can make a deal so that the incumbent companies, the companies that are actually making the deal, can actually come out pretty well. R.J. Reynolds and what was then Philip Morris, what is now Altria Group, basically the way the master settlement is structured gave them a near monopoly on what remains of the tobacco market in the United States. They also no longer advertise against each other, which saves them scads of money. They had to pay a bunch of money to these states and to that. Then the trial lawyer skimmed off a bunch, but there's also some crony capitalism involved.
Yes. So for any listener or viewer who is excited at the thought of hurting big companies, remember that when you hurt big companies by using big government, you usually end up with the big government even more controlled by the big companies that you were trying to fight.
The big companies have really good lawyers, and they can figure out a way to make the big company gain an advantage, even if it's losing scads of money in the process.
Yes. And eliminate competition.
And by eliminating competition.
Yes. Well, let's talk a bit about the scale of the situation. This opioid crisis, many of the crises bruited about in public policy talks are not really such crises and don't have nearly as gruesome a fallout as one would be led to believe by listening. But this may actually be a real crisis.
I would drop the maybe. I would say is. We are losing more than a Vietnam War's worth of dead to drug overdoses every year at the current rate. In 2015 and 2016, so many people died from drug overdoses that, combined with the general way of the world and the general way of life in the United States, that American life expectancy actually declined for the first time, 2 years for the first time since, I believe, the end of World War II.
This is similar, reminds me of one way that you knew just how messed up Russia was that while all the rest of the developed world had increasing life expectancies, Russia, both under communism and then after, mainly because it's the leading alcoholism country, thank you, had declining life expectancy. You have to have a very screwed up country to have declining life expectancy.
Right. And to get an idea of, how it may be affecting the rest of American life and our politics, the decline in life expectancy was contained among Anglos, among white Americans. And it is not unreasonable to suggest that part of the reason that there was so much disruption in our politics in 2015 and 2016 had to do with the fact that people were literally dying, people in these communities were literally dying. When President Donald Trump in his inauguration speech is talking about American carnage, this may not be what he is talking about, but this is what people are hearing.
Yes. How about another statistic or two to give listeners an understanding of the scope of what we're talking about?
So, to get an idea of how many people are currently believed to be hooked on opioids and other drugs, the CDC estimates that over 2 million people are hooked on prescription painkillers, in a grand total, maybe up to 2.5 million are hooked on any opioid.
Which would include the street drugs
which
as well as the
which
prescription.
includes the street drugs, and we'll get to the street drugs in a moment.
So and the street drugs are another part of the problem. But that obviously people who may get hooked on prescription drugs, then they're cut off for one reason or another, or they can't afford them, and that leaves them then willing to try the street drugs, which bring new problems.
Right, and the street drugs are getting worse. It used to be, heroin is a strong drug that will kill you if you become addicted. It will kill you over time. Then you have fentanyl and carfentanil, which are stronger opioid derivatives that will often kill you by an immediate overdose. And, the street drug dealers, the street drug cocktail mixers, part of the way the drug market operates is that the street drug manufacturers actually, if somebody ODs on their stuff, all the junkies want the stuff that made the guy overdose, because they're chasing the high that they got the first time, which you never get, and that the addition of these even stronger opioids to an already existing heroin market has just increased the overdose rate ridiculously.
Now, we mentioned earlier that the Trump administration has declared a public health emergency. That's actually a technical governmental term.
There's a legal definition of what a public health emergency is.
So what difference has that made?
Mostly semantic, mostly just a rhetorical, this is a problem. The amount of money in the public health services, public health emergency fund as of last October was $57,000. It's not a big pot of money. There was some discussion about declaring it a national emergency, like a major hurricane. The problem is that the law that is written to define a national emergency doesn't really apply to a slowly developing and chronic situation like we have with the opioid addiction explosion in the past couple of years.
Yep. I would say that, and the national emergency, it's again, one of the problems with government, and it's the great inefficiencies involved are, I have some friends who were involved in the government right after the Katrina hurricane hit, and they had the same kinds of issues where things were desperately needed, but the existing laws, which govern how you can give money away and to whom and for what purposes and this, that, and the other, because we are a nation of laws, sort of, at least, hamstrung all kinds of efforts, because even when you have a better fit between the law and the crisis, government still has a very hard time walking and chewing gum.
And good luck getting Congress to appropriate money for anything.
Yes. Opioid addicts probably don't vote, so that would lessen the appeal to politicians. But there is, you talked about struggling communities. There is evidence, of course, that the opioid crisis is connected to other long-term problems in certain communities and parts of American society. Can you tell us a bit about that?
So, since the 2008 the financial crisis and global recession, a lot of people, specifically men, have dropped out of the labor force. They are no longer working. They are no longer seeking work. And what some research has found, former Obama administration, I think he was chairman of Council of Economic Advisors, Alan Kruger, he estimated, or he found that approximately half of those men who have dropped out of the labor force are on pain medication and take pain medication daily. Now, many of these people may be genuinely disabled, may be genuinely hurt. Yeah,
they may have worked in places like coal mines and steel plants and the
steel
rest.
mills, places where you're bent over and on your feet all day, and now it hurts. But some of these people probably are not. Some of these people are probably in that category of drug abusers who may have started on maybe even a legitimately prescribed pain medication, or they may have taken pain medication from somebody they knew that they weren't supposed to, and have become addicted and are now servicing an addiction.
Yeah, one suspects that the best place to have a better understanding of that is probably not economists and their regression analyses, but J.D. Vance, the brilliant author of Hillbilly Elegy, which really paints a portrait of the kinds of communities that we're talking about.
Of his family and their dealings with all sorts of drug addictions.
Yes, and in economically distressed areas,
Right.
as we say.
In places like West Virginia, Southern Ohio, Eastern Kentucky, a lot of places where the smart go-getters have left for better opportunities. The workaday jobs that used to give a middle-class existence have gone away for whatever reason, leaving behind people who are subsisting on SSDI, disability insurance.
Yeah, Social Security disability insurance. Yeah.
People who are subsisting on food stamps. A lot of the poorest counties in the United States are in this region, just because there is kind of no economic activity that has survived.
Yes. Well, let's go to our specialty, which is the influencers involved in the issue and the connections between them. There's a lot of issues here at stake, isn't there? But let's start with what really is the backbone for lawsuits by people like Mayor de Blasio, and that is the claims against the pharmaceutical companies.
So the theory behind holding the pharmaceutical companies liable or ultimately accountable as the cause of the crisis is that they encouraged, through either deceptive marketing, kind of ignoring the risks of addiction, ignoring the risks of overdose, encouraged physicians to write lots of prescriptions for lots of opioids that they probably shouldn't have.
That's the theory, at least.
That's the theory. The major drug maker lobby, just to kind of get an idea of who the player is here, is the Pharmaceutical Research and Manufacturers of America, better known as PhRMA. Because of the industry's size and influence in all areas of healthcare policy, not just drug prescriptions and drug approvals and FDA stuff, Food and Drug Administration is responsible for approving drugs for sale. But also the structure of the healthcare system, health insurance reform, what to do about Obamacare. PhRMA is always one of the major lobbying spenders in Washington, D.C. In the fourth quarter of 2017, they spent roughly $6 million and came sixth overall among spenders, and they're fifth if you combine the Chamber of Commerce itself with one of its ancillary groups.
Yes, and I can't resist an aside, which is beating them out in that quarter for spending was one of George Soros's groups, which actually spent more money lobbying than the PhRMA trade group of notoriety, and that's probably a good topic for a future episode.
We will come to that at a future date.
Yeah. Now, drug makers have also funded other influencer groups too. Tell us a bit about that.
Sure. So one of the classic strategies to convince Washington that you're not just some sleazy business, but that you actually represent people who vote, is for a corporation or a labor union or any entity that is a special interest group to fund advocacy organizations that are not obviously them. So if you're a drug maker, you give money to the International Pain Foundation or the American Cancer Society Cancer Action Network or the American Academy of Pain Management. And then these people come out and they talk to their congressmen or their state legislators and say, no, you can't restrict the amount of opioid prescriptions, or you can't, or you should have Medicare use pain management as a as part of the part of the questionnaires that hospitals are required to give to Medicare patients, so that Medicare can decide whether the hospital is doing a good job or not and whether they should get paid. So what the drug makers did was they funded these groups. They funded, American Cancer Society, Cancer Action Network, American Academy of Pain Management, International Pain Foundation, some other nonprofits, and then these groups did advocacy that supported the drug makers' desire to sell more opioid painkillers.
Or put another way, to have fewer regulations and reporting requirements and the rest on such things. So there's a plausible case, but not a dead certain case, I suppose, about this. But one thing, of course, when we talk about, again, government getting involved in things, is there are always unintended consequences, are there not? So tell us a bit about the unexpected or undesired byproducts of the greater regulations that have, despite pharma and its friends' efforts, grown in recent years.
So going back to 2010, a new formulation of, I think it was OxyContin, which is one of the major opioid painkillers.
Prescription.
Prescription opioid painkillers was brought out that was more tamper resistant. So you couldn't, cut it and
I think it was crush it.
Yeah, you couldn't crush it, divide it up, sell it, and then sell it to people who will abuse it. So that took some of the illicit prescription painkiller out of the illicit prescription painkiller market, and then throughout the mid 2010s, as this opioid crisis as painkiller abuse, more so than what we now think of as the opioid crisis. But as painkiller abuse emerged as a problem, the government tightened the regulations on how much you could prescribe at any one time. The theory being that if you cut the supply of opioid painkillers, prescription opioid painkillers, going into the world, that fewer, teenagers are going to sneak into their parents' medicine cabinets and steal their Vicodin. Fewer people in West Virginia who are on disability because they threw out their hip when they were in the coal mine, and are, maybe cutting a couple pills and smashing them up and selling them on the side illegally for a bit of spending money, so that doesn't happen. One of the unpleasant byproducts of this is that the people who are already hooked start looking for alternatives. And the alternative that was supplied to them by transnational, international criminal organizations was heroin and the super dangerous novel opioids like fentanyl and carfentanil. And whereas someone on prescription painkillers may have an addiction but may not be killing themselves, may not be overdosing, put somebody on fentanyl or carfentanil and they are overdosing. And that become, again, a prescription painkiller addiction is bad. A opioid addiction that leads you to use fentanyl or carfentanil is even worse.
Yeah. Then on the flip side of things, of course, there are the people who genuinely have very serious chronic pain or end-of-life pain, and the regulations that were intended to deal with abusers hit just as hard against legitimate pain.
Right. The people who need painkillers, again, because they're coming to the end of their lives, or they just have chronic pain. Now, there's some question in the medical literature about whether opioids are the best treatment for that, and we'll actually get to some of that at the end of our conversation today. But the facts of where medical science and pharmaceutical science are right now is that generally they have been prescribed opioids. That's generally what's available. And then the government comes along and says, no, you can't have it because we're afraid that the prescription painkillers will get out into the general public among people who aren't supposed to have them. And then all of a sudden you don't have a sufficiency of pills to treat your pain.
Well, now to get pull back into the history of this a bit, we talk now about the opioid crisis. Back in the 90s, there was talk about insufficient medical attention to pain. And some important influencers like the large hospital chains and even the federal Veterans Administration system responded to this in ways that led into some of the current problems. Can you review a little of the history for us?
Sure. So the American Pain Society, which is an association of pain management physicians that was very active in the 1990s and funded in part by Purdue Pharmaceutical, which is an opioid painkiller manufacturer, they promoted this idea of pain as the fifth vital sign, which is why when, at least until very, very recently, if you went to the doctor with any sort of complaint, the doctor would ask, are you hurting today? Are you in pain today? If you said yes, scale of 1 to 10. And then the doctor would be expected to treat your pain. So let's say, I fell off my bicycle, broke my wrist. In addition to setting my wrist in a cast, I would be asked, how much pain are you in? And I would then have to, because you can't, short of having like electrodes hooked up to somebody's brain, you can't determine objectively how much pain someone is in. I've never broken a bone in my life before, so I'd probably say something pretty high, like a 7 or an 8. And that could be enough in some places to get me, Percocet or some, very strong, potentially opioid painkiller. Now,
more recently, of course, a different influencer, the American Medical Association, has reversed course somewhat on this. Is that right?
Right. In 2016, as the opioid crisis became a crisis, the American Medical Association, which is the biggest sort of trade and professional association of doctors, and is extremely powerful because it controls the copyright to doctors' medical billing codes, which is why it's really through the control of the billing codes more so than their membership that the AMA leverages its influence. Their National Assembly, National Representative Assembly, voted against treating pain as this fifth vital sign.
Yep. Now other important influencers have played a role too, such as the Centers for Medicare and Medicaid Services, which is a big chunk of the Federal Department of Health and Human Services.
This is kind of a classic case of the federal government functioning as an influencer, because when the government makes a regulation, it affects how all of the other players deal with an issue. So what Centers for Medicare and Medicaid Services did was they have a form that they give to patients to rate hospitals and doctors' treatment. And in 2006, what Centers for Medicare and Medicaid Services added to that was a question about how well the hospital dealt with your pain. And this led hospitals and doctors whose payment is in part based on these surveys to be more aggressive in treating pain. And the standard treatment for pain is painkillers, many of which are opioids.
And then more recently, you have another governmental entity, the President's Commission on Combating Drug Addiction and the Opioid Crisis, and it got into the act.
Right. So shortly after he got into office, President Trump convened this commission chaired by then New Jersey Governor Chris Christie that was to look into the causes and what to do about the opioid crisis. And in one of its determinations of the cause, the commission found that this idea of pain as a fifth vital sign was a contributing cause to the crisis and should end. They held in then Governor Christie's letter to the president, he said it was a quote a core cause of the culture of overprescription in this country that led to the current health crisis.
But having said that, we have been stressing to a great extent today. We've been talking about doctors and medical groups and government health agencies. But as we mentioned earlier with the case of J.D. Vance and his famous book Hillbilly Elegy, this really does involve more than just the health sector of America, doesn't it?
The health sector can be thought of as the supply side, but there is a demand side. The demand side is the sort of general social dysfunction, especially in places, that we've been talking about. Southern Ohio, West Virginia,
Kentucky,
the mountain regions of Virginia and North Carolina, Arkansas. What we're observing is as economic opportunity has gone away, as the young and ambitious have left to major cities, the people left behind are experiencing what economists Ann Case and Angus Deaton are calling deaths of despair. The amount of economic opportunity available to a middle-aged, not particularly well-educated man in these places is basically nil. And because they don't have a social framework, one of the big risk factors for dying of overdose is that you're divorced or you've never been married. If you are married or widowed, your risk is much less.
So the collapse of the family, which has been spoken about at this point for about half a decade.
You mean half a century?
Yeah, sorry, half a century, not half a decade.
The Moynihan Report was in the late 60s.
No. I meant, sorry about that, misspoke. Half a century, for at least half a century, is deeply connected with this. And I have to say, I can't resist pointing out, as a member of the cis heteropatriarchy here, I can't resist mentioning that precisely the middle-aged, divorced or never married man in West Virginia that you're talking about is not dripping with white privilege.
If you're wondering, if you're a progressive and you're wondering why some people dismiss the notion of privilege, and I actually don't. I think there is some blessing. I think there is an interpretation of that has some merit, not the way that then the left grabs it by the scruff of its neck and runs it 50 yards to the left. But there's a nugget of truth growing in there. But if you wonder why some people are dismissing it out of hand, the notion that there is this massive public health crisis that nobody really, I'll speak from from my personal experience. I consider myself a fairly close observer of America. I read magazines, I read the newspaper, I read all the wire services on Twitter. And until, interestingly, it was then Governor Chris Christie gave a big speech in 2015 in anticipation of the presidential primaries, I had absolutely no idea, as an inside the Beltway elite, that this was going on, that there was this crisis of drug addiction rocking suburban and rural America. And one of the complaints that lefties make is that well, hold on a minute, when drugs were ravaging the inner cities and the victims were not Anglo middle-aged men, you guys didn't care as much. And I'm sitting here going, No, people were well aware of what was going on, and it wasn't until very, very recently that we were even remotely aware that a crisis of this scale, again, a Vietnam War's worth of deaths every year.
Yeah. Nor I mean, grim and highly regrettable as the urban deaths were, they weren't so on such a scale as to lower the life expectancy of the nation.
Right. For all the changes in demographics and the changes of how we count people, if a crisis of this scale rocks Anglo-America, you see it in the national statistics, even if it is not, even if other demographic groups are not nearly as affected by it.
Well, to turn on a slightly more optimistic note, there may be some alternatives to some of the drugs that are currently causing the problems. Can you tell us first about kratom?
So the idea, one of the goals now of some medical research is to try to identify an effective painkiller that is maybe not necessarily non-addictive, but if it does addict you, you don't end up down the death spiral that a lot of opioid addicts undergo. But that is still effective for treating pain, and ideally is effective for treating chronic pain, which opioids, the medical literature is kind of unclear on whether they're really any good at it. So a couple of sort of herbal drugs that are being considered. One is as you said, kratom, which is a Southeast Asian originated herb that has been consumed in that part of the world as a pain reliever, as an analgesic, as probably a recreational drug. The DEA has tried to ban it, citing a couple of fatalities. Those designations that the fatalities are caused by kratom itself have been contested. It's kind of not clear. If you read pro-kratom sources, they say it was other drugs. If you read government sources, it was kratom itself. We don't really know. And there is some prospective medical research that suggests that it might be useful as an alternative painkiller that is, quote, much less harmful than prescription opioids. Now, there's a potential for a market failure here. It's a pharmacologically active plant that, if it were legal, you could just plant and grow. So it may be more difficult for pharmaceutical companies to patent and to make profit on.
Yeah, and we should add that the government doesn't help by the fact that the typical drug working its way through the Food and Drug Administration approval process takes $2 billion on average of costs before, if you're lucky, at the end of your $2 billion outlay, then you finally get to try to sell something.
And the sad thing about potential research into kratom is that the current FDA commissioner, a gentleman by the name of Scott Gottlieb, who used to be at the center-right think tank American Enterprise Institute, is in kind of other areas pretty aware of that
the problem
of new therapies and new generic pharmaceuticals being kind of too expensive to bring to market. Now, again, we can wonder why this in this circumstance he isn't. Is it, again, conservatives are known to be ideologically averse to drugs that haven't been used in Europe for 10,000 years. Is there pharmaceutical lobbying going on behind closed doors? Is the medical research actually support his position? Again, that's beyond my expertise. I don't know.
In addition to the kratom, there's also some put forward medical marijuana as a possible help with this problem.
The thing about medical marijuana is it's kind of hard to say where the kind of the line is drawn. We don't really know yet whether medical cannabis or the compounds in cannabis called cannabinoids could serve as an opioid substitute. Part of the reason is because doing research on it is extremely difficult because marijuana is a Schedule I drug, which means that it has no reasonable medical uses.
By legal definition.
That is a legal definition, not a scientific definition. Now, there is some research ongoing, both in the U.S. and Israel. And there's also some economics research. Now, a bunch of states have legalized marijuana. Some, an increasing number, Vermont did, I think, last week, have legalized it just as a recreational substance, which, of course, if it's a recreational substance, you can self-medicate with it, or have legalized it for certain medicinal reasons. And there is some evidence from economics literature that the opioid fatality rate in states that have medical marijuana is lower. Now, why might that be? Well, it might be because cannabis is a good substitute for opioids, and people who have chronic pain are taking cannabis instead of opioids. That would be kind of the very good reason. The potential not so good reason, although if people are dying less, it's probably not a bad reason, would be if people who are considering what recreational drug to use were found marijuana more available and were using that instead of heroin. It's hard to tell.
And I know that speaking of influencers who are no longer with us, but James Q. Wilson, one of the most prominent social scientists of the 20th century, and the chairman of, I believe, the very first presidential commission about drug abuse, he went to his grave not too many years ago, always against the increased legalization of drugs, arguing, among other things, that if you dramatically lower the costs of something, there will be more demand for it.
Well, that's an interesting side effect of the opioid crisis specific to opioids. There have been a number of pieces. On the right, David French and Robert Verbruggen. On the left, actually, I forget the guy's name, but one of the writers at Vox, who have said, we can have a debate about marijuana, but if there's one thing we've seen from the opioid crisis, it's that the legalization of hard drugs or legalization of opioids and opiates is probably not a good idea, even if you had a pre-existing ideological commitment that the war on drugs is bad.
Yes, because obviously cannabis is simply not nearly as life-controlling as opiates.
It is the amount of cannabis you would have to take to have an overdose is beyond that which people take on a normal basis. Whereas with opioids, the amount that addicts are taking on a normal basis, even before you get into the, did they use carfentanil instead of fentanyl, can be enough to kill you.
Yeah, well, we can't settle all this today, but thank you so much, Mike, for giving us a much deeper understanding of the influencers behind this genuine national health crisis. That's our show for this week. If you're listening to this on iTunes or Stitcher, know that we broadcast a live video version of this podcast at 10 a.m. on Thursdays on Facebook Live and YouTube, and you can find our pages by searching Capital Research Center. If you're watching the video version, we encourage you to subscribe to the audio on your preferred podcast platform. We'll see you next week.